coming and calling in. Sorry, I was not here last month. I was in Kansas City learning all about summer. So let's start with introductions. Do we have anybody on the phone with us today?
Yes. Hi. Yeah, you have someone in the Sorry, Gail or another person? Gail from the Plain Community Health. Vienna, Regional Outreach Coordinator for Southern Oregon.
Awesome. Sorry, what was the name? What was the?
This is Jillian with the South Central Early Learning Hub.
Who was the one before Jillian?
Deanna.
Deanna. Oh, Deanna, right. Yes. Anyone else on the call? Okay, I'm Susan Plantier. I serve as the this year's CHIP and CAC president or chairperson, whenever we are called. That's right. You can call her to order. And I'm the revenue cycle manager for Lake Health District.
I'm Christine Albertson, the grant writer and coordinator for the Health District.
Okay, the Lake County School District 7.
Holly Hammond, Food Corps Service member in here.
Paul McGinnis, Eastern Oregon Coordinated Care Organization.
Diane Clay, a consumer advocate.
Michelle Tongan, DHS Self-Sufficiency.
James Williams, Lake County Commissioner.
Well, Freeman, care coordinator for the clinic. Kristen Hill, patient navigator for the Health District.
Gloria Stringer with the Lake County Crisis Center.
Andrea Wishart with the Lake County Senior Center.
Nam Dave, clinics director with Lake Health District.
Judy Clark, Director of Public Health.
Okay. I believe minutes were emailed out and hard copies are available here. If you want to take just a moment to review the minutes, make sure we don't need to make any amendments, and then move forward.
One correction, maybe it's not a correction. Was it EOCCO that applied for that best you wanted grant?
Yes.
Okay, I remember who you got.
Well, it was actually Bill.
But you're the same now.
No, not.
No?
No, we're still two separate organizations, but some staff, like myself and others, are EOCCO.
Perfect.
Have any other corrections? Is there a motion to approve the minutes as corrected?
Oh, motion. Okay.
All in favor? Apparently only Chrissy's voting.
Madam Chair, can I make a comment though?
Yes.
Because it's accurate what the minutes say, but there was a big change almost afterwards when the contracts came to be signed for the CCO. The information about us not being able to capitate payments to community mental health programs, it was all redlined out. So that method of payment will still be there, but we've got to move by 2024 to 70% value-based contracts. So things are going to change, but not the way I was
They were reflected
anticipating
in the minutes. Yeah. The minutes are correct, though. It's
Yes,
just-
that's what was
For that
there.
time, yes.
Yeah.
Okay, well, that is good news for us to hear.
Yes.
I was a little concerned when I read those minutes.
Every community mental health program in Eastern Oregon was concerned.
Yeah, everyone in this room was concerned when it was taking place, so.
Okay, well, that's good news then, and I'm sure there will be much more information to come before 2024. Okay, so we approve the minutes as corrected, and we will move next over to Judy Clark for our reproductive health survey.
Thank you. Is that real quickly? I'll give you some to pass down, guys. So for one of our grants in reproductive health it's Program Element 46, and we did it last year, and one of the things that we did is we wanted to make sure that people in Lake County had access to care, that tried to find out what barriers there were for care. And so the top sheet that you see there, we at Public Health made up a questionnaire that I took to Paisley High School, I took to Lakeview High School twice, and I took to two dinners for Hispanic ladies in town. And we had great turnouts. And so if you kind of look through it, I won't spend a lot of time on it. My takeaway from it, so the first page is Paisley, and there were 46 students who participated in it. I brought pizza, and we sat. I didn't do any sort of talks. I just gave them the survey, and we had a nice little visit.
It's actually the third page. Paisley's the third page.
Oh, Paisley. Oh, I'm sorry, mine's opposite here, sorry. Let me look at what you are looking at. And, so the first one's the Hispanic group, 44 people participated. Their main concern, the main takeaway from that is they were concerned about privacy. They were concerned about cost and insurance because they don't have it. And they really would like to have a provider that would do care besides reproductive health. None of those were surprising. The reason why they're concerned about privacy, the ones that I chatted with, was because we have our interpreter in such a small community that some were related or good friends, and they were uncomfortable having her interpret. So that was the privacy part that they explained to me. Moving forward from that, there wasn't much I could do except we've increased, Kathy comes to us more, who's our nurse practitioner and is doing more exams for the ladies, and we have 2 interpreters now. So if there's one that they are friends with and don't want to interpret, we have another one. So that's helpful for
Do
them.
you utilize the phone line? Yeah,
that's
what I was gonna ask.
We don't. We haven't, because we
That
have
would
an
bridge that
interpreter.
gap.
Well, and they never come in and tell me that. This came out in the paper. It isn't they come in and say, I'm uncomfortable with her. You know, they did just.
Might be
they
something
never
that we
said
could
that.
market, that we have anonymous translators
Yeah.
available or.
Yeah. So I wasn't aware that this was an issue, and this is why we do this, is because then it made sense. I didn't think that there was any issues. So if you go past that one, the next one is Paisley. There was 46 students. There were a couple language barriers. It's because they have the charter school there, and so they were commenting on that. The takeaway for me on that one, number 6, I just put, a lot of them were repetition, so I typed out exactly how they put, it's on the next page, how they wrote their answers to number 6. And what they have said to me is they want it to be a social norm. They feel like when anybody brings up reproductive health in the school setting, everybody's uncomfortable. They want more services available to them because they don't have them from public health up there. They have to come to me. They want more information at school. They'd like to have me in school longer to explain more. We have gone up and talked to the high school students and the junior high school students in Paisley. Last year was the first year that they said no thank you. So I didn't go up last year, and then I just went up for the survey, so I think I can use this. We're going to talk to Paisley Board on the 14th to say the kids kind of would like us to have us back in here. They don't feel like they're getting enough from the teacher. And great group of kids. And that kind of is what I'm feeling that they wanted from their surveys. The next pages I did 2 at the high school, our high school. These were only high school kids, they weren't junior high kids. There were 58 students, and it was pretty even numbers between male and females because I gave out gift cards and food, so the males were also very interested in coming, and that was purposeful. So they had kind of the same concerns. I was really fascinated and pleasantly surprised when I saw that a lot of them got care from their doctor's office. It wasn't just all public health. 7 out of 58 actually talked to their parents about reproductive health, which I thought was great. I didn't even think it'd be that many. Their biggest issue also was education, having more time, privacy, worried about how the billing process is. So I go into the junior high and high school every other year. The kids take, so it's twice a year, the kids take, twice during high school, the kids have health. So they have it every other year. So during that class, I go in and I do a reproductive health talk. If you're missing, you miss it for a few years. It is just the time for one class, and so I have a lot that I have to put down, to them in about 40-minute time frame by the time people get settled in. So with all the results from this, what I did for this year is I'm going into the school, and I'm not doing a reproductive health talk. I'm meeting with 7 through 12 in classes and talking just about public health, how public health works, how billing works, what services we provide, and just letting them get to know me and ask questions about that. And then I will continue the reproductive health talks in the health classes. But that way I spend 10 minutes out of 40 just talking about abstinence. So I mean, you're whittling down time that I really don't have a lot of time to talk about much, because I'm really trying to push abstinence and then talk about billing and stuff, and they're just not having enough time for that. So that's my goal, and that's what I'm doing this year. I'm going to Paisley, if they allow me, for one visit, going to Christmas Valley, where we've never gone, if they allow me for a visit, and then doing, but not, I apologize, I'm not going in the schools in Paisley and Christmas Valley unless they let me. I'll try to do it at the public health setting if I can't, if the school's uncomfortable with me coming in. And then at the high school, like I said, I'm going into English classes and social study classes so I can hit all the kids of all ages. And so I'm working on that this coming month. And then moving forward from this, I have another grant that I'm working on. It's every year. And this year, I am doing more reproductive health talks for specifically teenagers at public health. And I will do one in Christmas Valley, one in Paisley, and a couple here, break them up into sections again. So one is just about privacy and billing. The next one will be about actually services we provide, and provide them with dinner and some incentives and stuff again, and see if they feel a little more comfortable. And then we'll do a follow-up survey and see if it helped at all. But if anybody has any suggestions, I would love to hear thoughts on if there's anything you think I can do that would be helpful. I presented yesterday to the school board here, and we'll do Paisley on Monday. That's kind of it. Thank you for your time. If you have any questions, holler, please.
I'm not sure if Christy is able to help you out, but are there any like one-pagers from Outback Strong about, the positive community norming for learning about reproductive health? But I mean, if they're asking for it to be a norm within the,
right,
that's our vehicle for that.
Well, and one suggestion that really stuck with me, and I think it was from Paisley, actually it was on the Paisley page, was to please give out information that doesn't have a logo, that doesn't say public health, that doesn't say Outback Strong, that doesn't, so that if a parent or somebody sees it, it doesn't mean they came to me, they got it from me. It could be for school, it could be for a project, it could be just because they were looking it up, but it doesn't identify with public health because they have concerns about people knowing that they were public health. I thought that was a great idea. I always purposely put public health on the top of things so that they know, well, for one, that it's accurate information, but there, you know, that was a request to think about. There were a few good ones.
See, the problem is with that though, is like that, although you could say on one side that that's good, you also have others here that says advertise at the schools and show that where you can get help.
Right.
And if you don't put that logo up there, how do they know where you can get help?
Yeah, and I think advertise is going in. They want us in the schools and they want to see us and be able to access us. And they said advertise on the radio, what services are provided. Radio cracked me up because I can't imagine that. And there were a couple that said radio, so
Everyone
we're gonna do a radio ad.
Paisley has its own radio station
Yes.
in the
I worked
school
at some.
upstairs, and the kids help do the programming.
Well, there you
They listen to the radio.
Yeah, so I just, and that was the one that said radio a couple times, so
Yeah.
there you go, that makes sense.
The Paisley kids listen to the radio because a good portion of the high schoolers are making the radio programs.
Nice.
And they're picking the music, they're picking the programs, what they want to listen to, the soundtracks, everything, so.
Thank you.
Paul, if you have our August and, oh, sorry.
Sorry, someone, I heard it being that on.
Did somebody else join us on the line?
I did, this is Vanessa Pingleton, with the South Central Early Learning Hub.
Thank you. We just wanted to get you on the roster. Okay, Paul.
Thank you.
So we'll briefly deal with the incentive measure progress report through August. Front page has us as a CCO as a whole. We'd really like to start seeing some of these things turn green. And what happens is that the ones that are green, currently the emergency department utilization and emergency department utilization with individuals experiencing mental illness, they always start green and then turn red as more people use the emergency department services. So it doesn't mean we've met that measure at all. And so we really should have started seeing, we saw developmental screens at this point last year was turning green, those kinds of things. So we're making a push, but hopefully next time we show a report, there's a few more greens on there. And then Lakeview, following up on Judy's, or Lake County, following up on Judy's presentation, which is on the last page, it's just that we actually have met the condition for effective contraception for our 15 to 17-year-olds, but we haven't met it for the adults yet, so maybe they need to know where to go to public health too. But overall, we're still under on that. We need another 40 people there. Remember on the last column is the number of those services and claims that need to be submitted to do that. Don't worry too much about the dental, the molar or the screenings for dental sealants. That stuff all happens September and October in all of our schools. Yeah. But if Mom has anything to add about efforts about the colorectal cancer screening, if kids have gone out recently or what the story is there.
Right, so
We need 44 more.
we have been working with the vendor through the grant that we had received, and from Lake Health Clinic, we have close to 70 kits that have gone out to 70 patients. And so far, we have received back 8 kits. But the kits just went out last week, so we should be seeing a lot more coming in. We have reminder postcards going out next week, and then we'll make phone calls. And this does not yet include our chart script data for colonoscopies, so that's going to add some number as well. So we are pushing hard to get that measurement.
Okay.
And for the developmental screening, we have 13 more kiddos Lake County-wide we need to meet. We have at least 12 in Lake Health Clinic that we have done in the last few months through Lake County. So we are working with NOAA at EOCCO to make sure we get that.
Okay.
You said it was 12 to double health?
Yes, at least 12. I think we have done more, but we have already gotten credit for those. We have at least 12 we have not yet. So we're working on that.
And then that oral evaluation for adults with diabetes was reflected in the minutes of concern that I had there because of other access issues. But I mean, it's pretty amazing that only 2 out of 103 have actually received that service. And again, that must be performed by a dentist. It can't be an expanded practice dental hygienist that does it.
Paul, is that claims-based information?
Yes.
Okay.
Yep. Any other questions on that, on the report?
I have one.
Please.
The DHS custody.
Oh, yeah, I
What
forgot to
does
say
entail?
that. It's, the numbers are crap. Well, I don't need to talk about them.
Okay,
Where do you guys say you have 6 of 8? I mean, there's like 2 in,
but what does it
Far
entail?
more than.
oh, what is the measure?
Yeah, what does that entail?
If a kid has been in DHS custody for over 60 days, then they must have had a oral health, physical health, and mental health examination within their 60 days.
Okay, so we're literally supposedly one away from accomplishing that out of the children that are already in
Right.
DHS custody.
But they kind of come in and out, you know, and I mean, Harney's report, I mean, basically, they said that they had 2 kids that were in DHS custody.
I mean, ours says we only have 8. I know
Right.
more than 8 off the top of my
Yeah,
head.
it's in Harney, it was one of 2. We just know the day is not right. So,
Is DHS at the table today?
Trouble is not. But I did ask them, they have like 32 in here right now.
Just
about 30 in,
32 right now
Yeah.
in
that sounds,
actual foster care.
that sounds more accurate. Okay. No other questions, I'll move on. Our leader was able to send out some materials and there's 3 sets of applications that are all due January 17th. The local community advisory councils, money for this year, as we said, you guys have $41,190 to invest as you like. I'm a member of the subcommittee, and if you remember in the past, these LCAC applications needed to be linked to an incentive measure, but that's not the case anymore. It says basically you can fund something in your Lake Community Health Plan or anything about social determinants of health. So it's wide open now, without a forced link to an incentive measure. Why did the committee agree with me? A couple of meetings ago, we went over the 2020 measures, which is what you'll be going towards, and there's very few of them that a community can actually influence. It's more at NOMS shops level, public health level, and at dental offices level. So, you know, it widens it open and allows you to be creative in terms of what you want to do. So that application is due the 17th. It does need a vote of this group. Christie will remember, you know, you guys have to approve the application. And Christie, you said you're beginning the process to think about things?
Yeah, there is a meeting happening on Monday to go over all 3 of these, which I put in an email, but I will remind everyone here too, please have these read when come with ideas, because we don't have time to sit in the meeting and go through the applications. So come with ideas to that meeting. It's at 1. It's at 1 o'clock on Monday, so if I did not send it to you, let me know before the next meeting, and I'll forward the calendar invite to you. 1 o'clock in this room. What? You took the doodle. Oh, I did take the doodle.
Probably on my calendar, sorry.
So the next set are the requests for applications. It's the 19-page document, the thicker one. If you would go to page 12, the introductory parts are similar, but just to show what is available to you. Again, very few that have local community advisory council involvement, but you're certainly able to influence whether other organizations go after those resources or not. So emergency department utilization for members with mental illness. In the past, you guys have had the ED utilization. We've dealt with the Navigator program and also you know, the targeting of, I think it was 33 people that were pain, was it pain related or just extra users?
Extra users.
Okay, but many of them had pain as a reason for it, okay. And I'm not sure, you know, I haven't seen any of the reports that, you know, going on the quarterlies, but, you know, if there's a twist there, you gotta use Eddie and pre-manage. Eddie is the Emergency Department Identification Exchange. So if somebody goes to an emergency department in Bend or Eugene, it comes back to the primary care provider that says your patient was here. And then,
Do we have to keep Eddie when we have Cerner?
Yes.
Okay, they all,
but when you're looking at these, the bold headings, you know, at the bottom of the page 12, where it says participants, that's who we expect would apply for the money. So that includes hospitals, primary care, and any behavioral health organization. On page 13 is assessment and treatment for drug and alcohol use. Two of the measures for 2020 would be the SBIRT, which is screening for intervention and referral to treatment, which is okay. I can screen you and say you got substance use issues, go here. And if you don't go, you still got credit for the screen. Now you have to get somebody to engage in treatment, which makes it much more difficult. Participants, again, would be primary care and behavioral health clinics. You'll notice when the behavioral health clinic involvement on this stuff, it's trying to push integration services between behavioral health and the community mental health programs. Diabetes poor control. This one, I can't help you, because you did this one with Living Well, correct?
we did, we don't have it right now, we did it the first year because it was so focused on Arcadia.
Okay.
We had nothing but trouble with Arcadia, so we did not participate.
Okay. Again, where it says funding on this one, you'll notice that there's some changes there. You know, it used to say up to 20,000 or something like that. Now it's $10 attributed to your panel size. So if you're doing it, I would try to claim all 1,845 people in Lake County,
Okay. rather
than splitting out north and south in terms of the membership, so that you could apply for 18,000 for that one, whatever it would come out to be. Oral evaluation for adults with diabetes. It's dental care providers are the applicants, but they can't do this without primary care, and so I'm not sure whether they write the application and then give you some funds to make sure that the referrals are coming to them. They're the only applicant there because now the DCO, dental care organizations that are part of CCOs, they have performance-based measures on the sealants and this one to be able to get, that's part of their contract now that they meet these measures, not just hopefully you meet them and then we share goods with you at the end. Then there is the kindergarten readiness and childhood immunizations, and for our early learning people on the telephone, this one just kind of bewilders me. I'm not sure. We have a mix of dental offices, early learning hubs, community agencies, public health and primary care. I don't know why they say kindergarten readiness when really it's a well child check between the ages of 3 and 6. I mean, if being healthy is part of being kindergarten ready, yes, but it's not that traditional sense that we had in our community health assessment when we showed the kindergarten readiness about whether kids knew uppercase and lowercase letters, their social and emotional development, whether they, those areas. I'm not sure that this addresses that, but I think it's one that we need to, I'm hoping you guys can look and be creative on this one. And then the immunizations for adolescents is page 17, pretty much primary care and public health. So those are the ones that were there. What you don't see is stuff that we've been pretty successful getting money with in Lake County. The adolescent well visits, the other measures that were more community-based, the colon cancer screening. And remember, even though those measures are going away, there's still an expectation that you're doing the adolescent, or the developmental screenings, because if we don't get them between 0 and 36 months, and we wait until they're 3 to start chasing them down for a well child visit, we've lost that opportunity to find the kids that need extra help to make them kindergarten ready. So, I don't know, we'll see what happens. I'm curious how this is gonna go down in 2020, because it's not the same game that we've been playing. And then, I mean, the outcome of the game is still the same. We have measures that we need to meet to get the money back that they're gonna withhold, but all of a sudden there's different ways of playing. The last one is the new ideas fund.
Before you, can I ask
Okay.
one question? 'Cause
Sure.
The continuing projects is part of this bigger one as
Yeah.
well. So right now, our ED utilization, we have the mental health cohort, those 33 people, but we're also tracking our frequent flyers, and that is what, 90 patients, just OHP members. But that incentive measure goes away at the end of this year. And so is that, like, the incentive measure goes away, and I had this conversation already with Angie and Comey this morning about colorectal cancer, that the incentive measure goes away, that's not something we can continue. And our proposal would not be approved if we approve the funding, so.
That's true, but when they talk about continuing projects, those are ones that have been continuing for many years. When there were first transformation grants,
Yeah.
that's the ones that they're talking about. You can't get each other. Not each opt-in is 1 year, and you move to the next.
Okay.
And then lastly, there's the new ideas projects. That's the one that can be submitted every 4 months and evaluated. There's now over $500,000 sitting in that pot. We get very few applications, and when we do, they're not original, new, you know.
They're not new ideas.
Yeah, pretty much.
Or new ideas.
I mean, the new idea that was funded was, Advantage Dental from DentaQuest is doing virtual dentistry. The technology to support having that advanced practice person. And hopefully when that expands, that would provide better access for like Kinsley and places like that, for them to actually get the care that they need in that community. But if you come up with something, I'd encourage giving it a go. So those are there, they're all, January 17th is not a good date for any of the LCACs that meet after the second week of the month. Because I just cut their time down by almost a whole month to be able to approve it. We should have a second Thursday in January before the 17th.
And it's on I sent the team for everybody meeting Monday, the goal is to have at least a rough draft ready for approval in December of that meeting.
Okay.
So,
Do we need to change the week of our meeting in January? To accommodate?
great.
Stressful time, very important time.
And then the last item for me is the CCO 2.0 community presentation. We do have this whole room reserved for the Oregon Health Authority's required meeting. We talked about it in the minutes last time around. I have made connection with Kelly McCord up at the Lapine Community Health Clinic and the North Lake Health Clinic Board of Directors. They'll have that space available. We haven't worked out the technology yet, but I mean, all we're gonna need there is a computer, and we'll give them a Hangouts link through Google. And, they'll be able to get on, and we'll be able to share the screen and be able to hear them asking questions if they want, so that they can hear this on November 14th from 3 till 5.
And this is gonna be where?
Right here.
Right here in this room. Okay.
Yep. And then linked up there so that people can come. They did, we had comments about what people wanted to speak about specifically, and there was a suggestion that, that whoever's coming, I think it's going to be Kevin Campbell for this one, and myself. Talk about workforce development, and then, you know, the folks up there that I connected with were saying similar things about expanding behavioral health services in two of the rooms in the clinic that they've remodeled for that purpose, but it's still not getting to the level of service that they want. So we'll try to address that, but mostly it's a workforce issue. Who's, you know, do we have enough clinicians? Well,
Somewhere else, yes, W's.
yeah, meeting and so forth. So the materials will start to be sent out. Somebody already registered, I don't know who it was, but they figured out, you know, from a flyer somewhere. But I didn't send the one out that has the link at the bottom, so that it's hyperlinked, so that if you get it electronically, hit that, it takes you to the webpage. The one that people have seen, you have to go in and type www, you know.
But they did it?
Huh?
We need that person to come up with some new ideas.
Yeah.
We need them to join our CAC.
So
Now, the next COCCO board meeting is on the 17th, correct?
Thursday
Hermiston?
the 17th in Hermiston, yes. You won't see me there. I don't like that they don't have a future plan for the board. You don't know when your next meeting is after this one. There's no like pattern.
I know.
So a couple months ago, I agreed to go to the Penn State, Michigan game. And
Yes.
I got my ticket and I'm going. I'm missing that board meeting.
Yep.
You can't plan ahead. So, you know, the media, our media person, Patrick Malvahill, contacted Susan. You know, and he said you responded back to him.
Okay, good. Thank you.
Right, so, you know,
That was my quote, yes.
the press releases there.
My press release, I
There were two radio spots that were developed, one 30 seconds, one 60. We'll make sure that they get to the proper media people. And then we had Facebook links that were suggested that we get those folks going on there. So we're hoping, I'm hoping for anywhere between 45 and 50 people in there.
Sounds good.
And then probably, you know, 15 or so up north, because they're already helping me recruit up there, so.
We should have you come to the PFAC meeting and talk about it. Make sure people are aware.
You're the CAC chair.
Okay, so give me some. I know, okay. We're gonna talk about that at our Family Patient Advisory Council also. That way maybe they can get some word out to more community members.
Okay, great. Any other questions on those? There's a meeting happening right now in Wallowa, our first one, and I'll learn tomorrow what happened with it and whether we need to make any adjustments. That was it.
That was it. Do you have any, anything pertinent from the RCAC to report to us in Sam's absence?
Our vendor represented the South Central Early Learning Hub. All our other early learning hubs had people there that were presenting what their projects were. The thing that got the most interest from what he said was the community baby showers. People really wanted to learn more about that. And then I just happened to see in the Bend Bulletin yesterday that Central Oregon Healthy, they're doing community baby showers too now. And inviting people to come in to give them, all the new moms, the resources and go from there. There were two presentations that were pretty interesting. I wish Will was here because it was what they're gonna do with the $1 billion through the business tax that goes to schools that passed, that sends some of our representatives off of the Capitol and out of the state. You know, there's about, I think it was, I don't know, it's about a little less than a third of it is dedicated to early childhood of that $1 billion. So there's opportunities there. The other thing that came that I thought was pretty interesting, John Adams with the Eastern Oregon Healthy Living Alliance, based here in Lakeview, is connecting with the Nutrition Oregon campaign. So this is Bob Moore, who was Bob's Red Mill, the grain people, that his fortune, the Moore Institute at OHSU, and the people sitting around here at this table, the eggs that made you were in your great-grandmother. And so they were talking, it's epigenetics is what they were talking about. It's pretty scary when you think about it, because we're now the third generation that's eaten a lot of processed foods. Everybody else was back, you know, and so it's likely that we're going to get more chronic illnesses, you know, until we can change what's going on with our kids and what they're eating to be able to make the eggs for their great-grandchildren. It's pretty interesting stuff.
It sounds like it.
But it also makes you want to just throw up.
Yeah, that doesn't stress me out at all.
I'll be checked out when it's really bad. So it was our early learning hub meeting. It's the September meeting we always dedicate to working with the hubs.
Interesting.
And yeah, it was pretty good. And then we tested out with the Regional Community Advisory Council members the basic presentation that we are making for CCO 2.0, and significant changes were made to that presentation based on people's input there. Most of it was words that they can't understand. And these are folks that are informed like yourselves, you know, that we got to kind of translate, what does a value-based payment system mean? You know, it's kind of like saying liberty and justice. What's it mean? People have different interpretations of things. Health information technology, those kind of things. So it was a pretty good meeting. But I would just ask Nam, because she made it up to the clinician summit, if she has something to add there about hearing former Governor Fitzhauber talk about 2.0.
Yes, it was an interesting talk, and I think there was a lot of discussion about the 2.0 payment model, and there was also good discussion happening about where we are going with the 2.0 and how the money which the CCO is getting back on value-based payment is going back into the system in terms of these grants, etc., and how there is a positive, like Oregon is a leading state when it comes to the CCOs. None of the other states have that.
No.
Right, so that was really interesting, and he was talking about the idea that the chronic conditions that, as Paul was mentioning, on that it's going to grow, and we need to be putting more money towards that and helping those things, like curb them and do preventive care so it does not suck more money out of the system. So, yeah, that's what I could remember from that. That was that.
What about the rest of the day?
It was really good. I think I attended some of the clinician-based presentations, and there was presentation about the opioid and the medication-assisted treatment program that is now going around all the communities and even rural areas. There is something called as a Suboxone treatment and Vivitrol treatment that some of the rural practitioners are learning how to use. And there was a presentation by a clinic in Northern Oregon named Winding Waters. They are sort of at the cutting edge on that. They now have a pharmacist in their clinic who helps out with the practitioners. And we heard from a practitioner, a social worker, and the pharmacist on how it's working. So it was really interesting to bring those ideas back and try to implement them in the clinic. And having a psychiatric nurse practitioner now in our community is going to be a huge positive for us, and she's already helping out our primary care providers and patients with the things they need. So I think that was the one that really stuck with me. And then there was a great presentation on meth, the forgotten drug. There was a presenter who spoke about, and then there were police officers on the stage talking about their perspective on what they're seeing on the streets when it comes to meth, and how that is something that nobody's talking nationwide, but that problem still exists in the community. There's a lot more talk about opiates, but we need to be talking about meth as well. And that's something that I completely agree looking at the day-to-day patient care that we have. So. Those were a couple of
Good.
really great presentations.
Putting you on the spot, and you did well.
Oh, thank you.
But I'll tell you, the other thing, besides that Nutrition Oregon epigenetics thing, the medication-assisted therapy wasn't encouraging either. I mean, the actual outcomes. So you get, I referred you for your problem, you actually went, so you engaged, and then we try some drug treatments to help you with your alcohol, marijuana, tobacco, other issues that you got.
Gosh, man. Like,
And the outcomes on those aren't real strong. You know, that, so, we gotta always mix that in with the cognitive behavioral stuff, the talk therapy,
yeah.
along with the drugs. If people want them.
Well, you never know.
Thank you, Norm.
Okay, Christy is going to share some CHIP and grant updates with us.
Here I am.
Am I the right one to do that?
Well, I'm writing my notes here, so I'm just going to grab from that.
Okay.
Sorry, I'm trying to use my roster real quick. Okay, so, fair warning, those of you involved in grant-related stuff, you're gonna get called on. We did the updates on the developmental screenings for our LCAC grants already, which is good. Prenatal, postpartum, how's that one?
I think it's going good. We are doing really well. At least in our clinics, we're able to get the patients in within the first trimester, and are having same-day availability with our urgent care has helped quite a bit. The walk-in clinic has helped quite a bit to get the patients in. And then for postpartum, we have a good workflow in the clinics where once the babies are delivered, our medical assistants are making sure to reach out to the mom and make sure that they come in with the baby during the certain time frame. So,
Is it the week before or the next one?
no, they have to get their postpartum is between 4 to 8 weeks after. So, but we remind them every time they bring the baby in, initially in the first 3 weeks, you still have to come for your appointment. So that's been working well, and the incentive cards that we have been a good incentive for the moms.
Gail, you're on the line, and I don't know if you've been able to track anything down yet. Did I figure out? What is it, yeah, okay. Have you been able?
Actually, no, I haven't.
Okay. We're trying,
No, I haven't had a chance to track anything yet.
okay. We're trying to get the updates from Lapine. They're doing the expanded veggie voucher program. They already have something in place giving vouchers to adults with conditions like diabetes who could benefit from eating more vegetables, and the LCAT grant is going to allow the Christmas Valley Clinic to let them prescribe vouchers for kids who, diabetes is a legit diagnosis, but kids who get certain diagnoses and we're eligible for SNAP, would be eligible for vouchers, and we just, with all the transition that's happened with the community health center, we haven't been able to track down any actual data to know how that is going so far. But we will get that.
Christine,
Yeah.
since I wasn't there when it started, I did pass it along to Marie, and she was trying to figure out what was going on with it.
Perfect, thank you.
Those were, weren't those LCAC dollars?
Yep.
Okay.
Also on LCAC, we talked last month, and it was in the minutes, about the playground equipment that we wanted to put in that's rocked in this park and why that is not happening anymore. I talked with Angie Comby this morning. A few of us met to talk about what can we do with those dollars instead. We still wanted to encourage the idea of families being able to be active together. And so we brainstormed some things that we might be able to do. Cooking classes was one of them. I talked to Tara, our dietitian here. She is willing to host a series of classes for some folks. At the end of the class, people would take home the ingredients that they need to make the thing that Tara just prepared, or they helped prepare, and a utensil, cooking utensil, or a pot, pan, whatever you might need to make it. That was to be the incentives for attendance. Other ideas, we had suggested the idea of doing ski and snowboard rentals and day passes at the ski hill. That was next.
Have we ever talked about putting the play space, that equipment at the ski hill?
Yeah.
I don't see a big need for that. Kids are super active at the ski hill.
In the summer?
There's also the hiking and whatnot.
I know.
And there's
but
bicycle trails and all kinds of things.
There's a lot of things that people could do, but that might really help make, because the ski hill is a public park. It is owned by the county, managed by the ski club, the Winter Mountain Ski Club. But in the summer, more and more things are occurring. People are having more events, using since the deck is now bigger and there's other things. You're right, during the winter it may not get used much, but it wouldn't get used that much in the winter at the Surreptitious Park.
And that,
Yeah.
I couldn't ask
Unless you
Angie
have
that.
permission to get
She
up.
was strongly discouraging us to stay with this.
Who was that?
Our Angie Colby, she's the OHSU, she's our program.
It's our
You can
park.
do events and stuff.
But it's their dollars.
There's nothing wrong with the park, just different
Our
location.
dollar, yeah, so.
Just saying.
Well, I think this is one I had to argue to even get.
Yeah.
And we were saying that it was social determinants of health, built environment, and that part of town we were trying to improve. And that's why they kind of let it happen.
They weren't
So you don't like my idea either.
In-
You know, some people.
In the minutes, it talked about that property was going to be for sale. Is there pending with anybody, or they're just intending to sell it? There's not no thought for a community park to do there? Is that a new idea grant that we could?
I think not everybody wants to live under power lines. Some people do. Hair-raising event.
Some of the other, oh, go ahead, Charlie. Other ideas that we talked about, and I sent out an email today, people are going to be looking into some different ideas. Tom Batty, the Tall Town, whatever, the bike shop. We talked
Cycle
about
town.
a family bike ride, renting bikes. The problem with that is he would have to order a lot of kid bikes, and our grants, I mean, we really need to wrap up all of our activities by the end of February, so biking might not be a great option. But he does have snowshoe rentals, and he will have cross-country ski rentals, so that might be an option. He also has the disc golf kits that you can just buy disc golf kits, so I'm wondering if maybe we could partner around with Level 48 and have some kind of event at Surreptitious Park. We're still using the park. Yoga was another idea that got tossed out, that we get some folks, maybe Francie and Jay to lead a yoga class, and one of the incentives when they go home is they get to keep their yoga mat or bolster or whatever they need to do those programs. These activities, the directive from Angie is that the activities are only for OHP members. So Noelle and I have already talked about how we can make that happen. The clinics would need to send out mailers to our OHP members who are families, because we're encouraging family activity. We're gonna build into the grant budget. Noelle says that she can come in on a Saturday, because we need the follow-up calls. But if you call so-and-so on Monday and so-and-so on Thursday, and then the Monday people have, they've got the reminder earlier, and they'll sign up and meet, because we'll only have a limited number of spots. So we'll talk, Dayla texted me, but I haven't actually looked at her. But that's one thing I want to talk with Dayla too, to see if maybe she can do that for one of them. So the email, if you were on her email list, what was the other one? The one that you're looking at? No, the dance, because that was something that Francie suggested, so maybe we can rent the sale barn at the fairgrounds and have a square dance or just a dance and hire a local band so that it's a family. And that's one thing that maybe that could be open to the community, as long as we do, again, the invitations to OHP families. So that is the update there. There's a deadline for everybody who's looking at because we have to present our updated budget with not just said we want to use this $12,000 for activities, instead we have to actually price out, this is how much cooking classes cost, this is how much this costs. So I need all of that research done. So there's, the deadline isn't there now. Adolescent welfare visits, that is the next grants chip related thing. And I don't know, I was not at the North Lake Open House, which happened on September 17th. But I do know that Serena from LaPine Community Health Center was able to be at the event. They signed up 5 kiddos, I think, for adolescent welfare visits. And those will be wrapped up by October 17th. And that we knew that going in, that North Lake, they do their AWCs, they do not do sports physicals. They will only do a complete adolescent welfare visit, so we didn't really need much for that. I know Francie was there, she did a presentation on vaping that seemed to be pretty well received. Was Ariana there for that one too? And Lily, yeah. And that is really, I don't know if anybody else here knows anything about how that went. Gail, that was before you got here, I think.
No, that was my first event, and we actually scheduled 5, but we had 6 that we had to schedule later. So it was a total of 11.
Oh, good.
12 child pets.
Perfect, so we'll be,
We don't know that all of those were OHP though.
no, but we'll be able to follow
That's
up.
what, I mean, things in the school don't have to be just for OHP. So think, you know, if you're redirecting the funds from the playground equipment, you could go a little broader there.
Right. The Lakeview Team Health Fair is on November 13th. There was some discussion about whether that date might change, but it is November 13th. I confirmed that with Carpenter today. Paisley is not going to be able to attend. That was why we were looking at possibly moving the date. There's too many other activities.
When is the fall parent teacher thing that we attended before
The week before.
The week before the teen health fair?
And I think it's usually a Wednesday, Thursday night, isn't it?
I
Because
think
teachers
you're
get
right.
Friday off.
Right, okay.
So I think it's the 6th and 7th.
And clinics, another question for you. Outreach to our 18 to 21-year-olds. How's that going? Are we getting any 18 to 21-year-olds?
No, that's something we have to remember and send out mailers. We'll make sure to do that in the next few weeks. But we have not done a good job of that yet.
The other piece of that, so our original proposal included having at our open house and at the teen health fair a station for reproductive health. That is no longer the game plan, but we did get a budget change approval. Judy talked about the presentations that she'll be doing about public health at public health. So we added a couple more of those. One at KCC, I just talked to you about this, and I don't remember.
Sure.
And then one at the library. And the library, our thinking of that is that that's where we get a lot of kiddos who are at the library because they need to use the computer, don't have computer access at home. So we thought that we might actually, we're not necessarily targeting the OHP kids, but that's more likely to see some of them at that. So. And we'll have those before the end of the year when the effective contraceptive use incentive measure goes away. We already talked about colorectal cancer screening. Living well people, we talk about living well stuff.
Our chronic pain class for September, October was a no-go. We didn't get enough people to show up. We currently have a diabetes class going with the minimum numbers, so
What is the minimum?
actually we have 6. I think the minimum number is 4, 5 or 6, maybe 5, with our first class. So we need to find a way to better advertise this and really get a little bit broader advertising and figure out a way to engage community members and let them know about these classes a little bit more ahead of time.
And then I don't know, I didn't have a chance to call Erin, but I heard rumblings that the diabetes support group is back on. Do you know anything about?
She hasn't said anything to me yet,
Okay.
but I know she wanted to get that going again in October, so.
And then part of our ED utilization grant right now, we're supposed to be starting a chronic pain support group. And that's you and Jane emailed me today and said you guys would get together. I don't know where that's.
We need to get together on that again. I know she sent me an email today saying, this kind of fell flat. I guess we need to gear it back up again. But I think she didn't want to do it at the same time that the chronic pain living well class was going on. So now that it's not
Dead.
yeah.
We were hoping to dovetail off at the end,
Right.
once that class finished up, say, hey, we got this starting up.
Can you talk a little more about the ED utilization, that grant and everything you have to say?
Just today, wellness file went through for Eddie and pre-manage, which was a huge hurdle. They were able to upload information into their system from EOCCO to get the ED disparity unit patients in there, but then once we went to upload the patient list in there, there's overlap. So we had to wait for pre-managed collective medical to build a workaround to allow for both those lists to exist simultaneously. So they are up running as of this morning, so that was super exciting.
Food Corps, any updates for us?
Hi. Putting me on the spot, Christy.
Yeah. I told people they would be called on.
I know. So let's see, so I started, so I don't know what you guys know about Food Corps and both was in this group the last 2 years, right? So I started teaching classes at the elementary schools kind of last Friday, and so this week has been more of a full week of classes, which has been really good. It's been really fun being in the classrooms. So I'm doing the teaching, and then, let's see, what are the other big things? 2 days a week I'm out at Union, and then the other 3 days I'm at Fremont, maybe Hay. Friday mornings also at Fremont. So kind of all over the place, working on the school gardens, especially out at Union with the greenhouse that's running. Trying to kind of get back into shape, actually, it's a lot of work. And then working on developing a plan for the Fremont School Garden, which is currently not a very functional garden, but trying to develop a plan and engage teachers and parent volunteers for making that happen this spring. There's certainly other things. Oh, I'll have a booth at the Teen Health Fair as well. And I should mention.
Excellent.
Thank you.
Christy, Nom wanted me to let you guys know that there will be a Medicare workshop November 6th at 1 o'clock at the Senior Center. It'll be led by Jane and Ariana from Public Health. Yeah.
About signing up for Medicare or?
It's a workshop, so I guess it's open enrollment time.
Right.
Yeah, just for people who have questions and to educate the community about
Jane,
the option.
Public education.
Mostly Part D, or is it just?
Intrigued. We've been asking for that for a really long time, and I didn't know that we had local people that.
I don't know that she's a trained Sheba, but she has tons of experience in it. And Rod Howard, he is getting his training in that. But
He's a Sheba? He's not a Sheba.
he's getting the training
Oh, okay.
currently.
That would be great.
But there is somebody assigned, you just go on the website and look, say Sheba person assigned to Lake, and they may have to come down from somewhere else, but
They're in
We're over.
Klamath and they.
Maybe that person's coming.
they covered their area.
They never come?
Well, yeah, rarely.
Rarely.
And they don't do any advertising and no one, I think this is awesome because we can flood the town with flyers and more people will know and, you know.
Yeah,
Can you
to
get
talk
that
about
in the various media, so everyone knows about that? Because that's a huge benefit for the seniors.
Don't put it in social media. Seniors don't do
Put it
social
there
media.
and.
Well, you can do social media, but you would
Yeah.
definitely want to use other avenues
Yeah.
besides that for sure.
Yeah, because very few of us, will work on our computers and all that, so if we can find it.
That's why you're here, you'll go tell them.
Pardon me?
That's why you're here.
Yes, I will definitely do it, Allison, and I'll get any flyers out that they want. Word of mouth is the best way with seniors, believe me.
That and putting up signs at the post office and at the grocery store.
You can't at the post office anymore.
Okay, well then,
Yes, that's the senior center and the Safeway. The best places to put it for them.
and the library.
Yeah. Yeah.
And Chrissy,
So 106, or 106.
That came out to all of us, I saw that.
Yeah,
what was it? I'm sorry.
yeah, November 6th, I didn't catch the time.
Oh, yeah, so it's not, I just want to add something quickly, not so much an update, but kind of like something I want to throw out there, and I've been talking about with Sing a little bit, and I know he's not here today, but the possibility of kind of rebooting the hospital's community garden. I would totally be happy to lead some kind of project to get that going again for the spring or later, or what that would involve, if that means applying for new grants, or just wanted to throw that out there, that's, I know it hasn't been, I don't know when the last year was that was
last year.
running, but, oh, was?
Oh, we tried to get it going, the pipes are all broken.
Oh, okay, so I knew I had seen.
No water, and I think I was trying to coordinate with Justin to try and
Okay.
get that going.
So that garden was originally a Rotary Club garden
Yeah.
on the hospital property. And the fact that vehicles drive over the pipes is what causes them to break.
Yeah, no vehicles in the garden.
Pardon?
You can't have vehicles in the garden and stuff, but I don't know if they may not have been properly drained either.
In the past, there were tractors that would go in and roam and kill the area.
Yeah.
And then the sprinklers were put in there.
Yeah.
The hospital would be happy to have somebody take that on as a project. The reason that it's stopped as a Rotary garden is because it was more food produced through the Klamath Food Bank. And we didn't have enough people taking the food. And it also, at that time, the prison, or the out of the prison,
Yeah.
that which is worked by the inmates, it was just getting going. Now it's a very robust garden. So if we could get enough people that would be interested, absolutely, we'd love to see it used.
Thank you.
Absolutely.
I did have a quick, back to the colorectal cancer, and I only have one clinic here, but just a reminder that built into our grant budget is the incentives. So you guys get $50 for every fit that's processed. If you have 50% of your patients on your list return the kits before Thanksgiving, that's an additional $500 bonus for the clinic. And if you have 75% finish by the end of the year, that's $750. So, bonuses.
50% by
Thanksgiving. The other update,
Hang on, help me understand that. That was written into the opt-in? That's part of the vendor program?
yeah, that's part of our budget, to incentivize the clinics to do more outreach to the old vendors.
So they get a double bonus then, right?
They get to bill for those kits,
Right.
but they don't pay for it.
Okay,
Mhm.
and then they check next week.
Yeah, right, yeah. Summer lunch program, just a quick, so I finally finished the report, our final report. Our vendor said at the last meeting that we served almost 5,500 lunches. We were 6 shy of 5,500 lunches. But going through the report, I did come up with some recommendations just based on how things went and the numbers and the information we got from kids and parents. So one of those, we need to hire our staff earlier next year, and there's a suggested schedule in there. We ran into, no names mentioned, but your son was one who was offered a position, but he'd already taken the job. And we know that Lakeview kids do tend to work in the summer, so the earlier we get it going, the better. The kids and one of our staff members, field staff members, really wanted more robust training going in, so that's another recommendation, that if we hire them early, then we can have like a weekly series of 5 or 6 classes before the lunch program starts, so we can cover some of the basics. And then make sure that they have ongoing training throughout the program, because for a lot of these kids, it is their first job of any kind, and so it's really up to us to make sure that we are training them how to be grown-ups. I mean, you're working with kids in this campy kind of environment, but how to be a responsible adult at a job. Because we did have some comments from parents and community members about our program leaders not necessarily engaging kids. And we had comments from the kids too, but we have no idea how to actually get kids to actually participate in activities, so training for both of those things. We had several comments about our meals, and nothing was bad, but people wanted more variety, so to make it easier for our staff, for Tara, who orders all the food, we have 5 menus, so Mondays are always this, Tuesdays are always this. And so we heard that the kids and parents alike want to see more variety, even if it's, we have 2 weeks worth of meals. Yeah.
Can I say that the gluten-free option is amazing? It was wonderful.
Good. But one of the suggestions is that maybe we could get kids invested in the menu planning, looking at you, food core service member, to work with Tara, and then they're learning too about, because we have to follow USDA guidelines, we have to have, the dairy and all the different pieces, and so they're learning about, you can't just serve the pizza and jelly beans every day, so that so they can learn that process.
They got it.
That's all I'm teaching.
Eat the rainbow, right? Jelly beans are good. And then, so Diane, you just talked about word of mouth, and that was one thing we wanted to know, where people were hearing about the summer lunch program. Overwhelmingly, people are hearing about it from other people.
I'm sorry, guys, I have a patient. Excuse me.
So one of the recommendations is to figure out how to engage more community champions, so that we are incentivizing people to help us spread the word about the program. The other one, and this came from me as the grant writer, is that I got all of the surveys basically at the end of the program, and so there wasn't time for any adjustments or corrections to be made in the program, so that'll be a change next year, is making sure that I'm getting that information so that I can in turn get it back to Armand or whoever's in charge of the program, so that if we need to make adjustments, like the food thing came up early and often, so that is the change we could have made happen in the program if we learned about it, so that'll be a change for 2020. And, sorry, I know I'm talking a lot, there's a lot going on now. Our opioid planning grant, we got our extension, I told you guys that at the last meeting. We have 2 candidates for our program coordinator position. We're interviewing them both here on Monday, so fingers crossed we'll have someone hired and ready to go by the 1st of November.
And that's still gonna be you, Jane, and Nam, right?
As the interview?
Yeah.
Yes. Yeah. And that person, again, is gonna be working half-time in Climate Falls, half-time in Lakeview. They will be a full-time legal district employee. Benefits all our project lasts through June 30th, so, yes. I told you guys last time that we had applied to join Permanent Supportive Housing Technical Assistance Cohort through Oregon Housing and Community Services. We found out Tuesday that we've been accepted to that. So that's the first step to, you have to participate in a cohort if you want to be eligible for the actual capital dollars. So it's a good first step for us. And the cohort starts next month. I think November is the first meeting. And that is it for all the grant stuff, I think. Thanks. Excellent. So,
Hey, Chrissy, just a reminder though, I don't know, because one of these had draft on the front of it.
yeah.
Make sure that the documents that you use to fill out have the word final in the document name.
I think these do. These all do, but still say draft on the thing.
Okay. There were some tiny little tweaks to them, so.
Okay. I might hit you up then for final, just to make sure the final.
Okay, I think I sent them out there.
Okay, then that's what I printed and then, yeah.
Well, I sent him earlier version too, because I wasn't sure it was gonna get approved in time. So I'll send those directly to you.
Okay, so I know Chrissy's gonna be carrying out really for those grants, they all come due at the same time, so I know from going through those experiences with her in past years that when we come to those meetings, being really prepared with our suggestions is super helpful. Yeah, it is really helpful for us to be able to further move through those, and when she sends us those nastograms in her email, she's really helping us because she knows that's how we're gonna respond, so we appreciate all of her hard work.
On that Monday meeting, Chrissy, I forgot to say, if anything, if you wanted to dedicate any resources to fruit and vegetable vouchers, we're open to add and work with the vendors and folks here.
Okay,
Under Frontier Veggie RX.
cool. That was something that
So-
Dawn had brought up.
So, yeah, 3 of the 4 that went into it have already voted to continue the program.
Cool.
Gillum, Sherman, and Harmony, and Wheeler doesn't meet till next Tuesday to decide whether they're in.
Okay.
We have just about 10 minutes left. Does anybody have anything for the good of the group?
Go ahead.
Well, we had some great news for the Senior Center Transportation Program yesterday. Our team met with our ODOT representative for the area, and our three proposals were approved, and the funding was approved for a, so excited about it, a Alturas trip, which we will do weekly, the plan is. So we'll drive to Alturas, meet up with the Sage Stage, which is their transit in Alturas, which also connects to Reno, to the airport, to the train, to the, so it'll be really awesome. And we'll return from Alturas, shortly after we drop them off, and then we'll go back down later in the day to catch the Sage Stage coming back to bring people on this way. So we won't roll out immediately, but we're working on the advertising on the Alturas end, because a lot of people come this way as well to all kinds of shopping, doctor's appointments, yeah, so I think it's gonna be pretty good. Really excited about that. Also, we have in the works a monthly, can't think of a good name for it, but not really a shopping trip, but like an errand bus, something, we'll come up with something catchier, but we have a dedicated driver on staff from 8 to 5 to drive people. They'll call, make an appointment, say, hey, could you pick me up at 10, and we'll to go to the DMV or go to the grocer or, all kinds of things. We had done away with a lot of that extra stuff, and we're focusing mainly on medical due to our funding, so we're able to offer this back. And the money is all coming from the transit tax, which you might see on there. So the county was awarded $50,000 for this first 6 months, and we're sharing it with a group of volunteers, ICFC in the north part of the county, and then our portion here to operate in Lakeview, and then also the north part of the county. But that was really exciting. In the north end, we're planning a trip into Lapine on a day that has their food box giveaway, because part of the scrutiny of the funds were that we needed to spend it for low income. So we're trying to meet some of that, help with some of that with transit. So that was really exciting just yesterday.
Is there a cost for?
It's free. We're able to offer it.
Even to all tourists?
Oh, no, sorry about that. The Alturas trip is $10.
That's still cheap.
And it goes once a week. Do you know what day it's going to be?
We're looking at a Monday because,
Wednesday.
pardon?
I said avoid Wednesday.
Yeah.
The shuttle, their transit goes to Reno Monday, Wednesday, Friday. We thought Monday made no sense.
And then the errand bus that you were talking about, you said monthly. Is it once a month, as many people as you can fit, when we're going to Safeway, or how are you doing that?
We're gonna kind of try to have some semi-designated stop areas, but really we'll just go wherever, one day a month, and we can't say a real solid date because we are trying to target it after benefits were awarded in the month so that we can, meet that need. So we're looking at maybe the second Thursday
And that's on the north end?
here.
That's here.
because we already transport out of the area to Klamath Falls or something, but there's quite a need here, especially when the weather turns.
Yeah.
That's okay. So I'm going to pass out the programs that we are distributing at the Outdoor Theater on Saturday. This October is Domestic Violence Awareness Month, and so we are sponsoring a movie event at the Altair on Saturday. Doors open at 6:15. Movie shows are at 7 o'clock. And so for the first 50 that attend, maybe you've all read it in the paper already. And on Facebook, they'll receive a gift that's related to what the movie's about. So it'll be a little surprise maybe. Those of you that read the newspaper article know that it's a brooch. And so we're including that. And we'll have our Hunter's Hot Springs basket there for everyone to look at. It's a value of $170. Tickets are $5. It's a one-night stay at Hunter's newly remodeled room. A real nice plush terry cloth robe. One size should fit all, I'm hoping. And then chocolates. The Gaslight Effect book is included. Information about the Crisis Center and about sets. So it's a nice gift basket for someone who buys a ticket for $5. I wanted to share how many clients we've worked with since the beginning of the year. We've worked with a number of clients, of course, DV, domestic violence, sexual assault victims, stalking and elder abuse victims, but we sheltered 13 domestic violence victims for a total of 22 nights at local motels, emergency shelter. We saw 57 domestic violence victims and provided over 65 services for those victims of domestic violence. And again, that doesn't include the number of clients we've seen for other abuse issues. We actually have seen about 109 since January. And so,
Is that up or down from last year?
it depends. It's about an average. 2 years ago it was double. It was 300 this year. But we were seeing a lot of clients that at that time didn't qualify for our services. You know, the criteria is that you're a victim of domestic violence, sexual assault, elder abuse, or stalking. Most of our clients are domestic violence victims, with stalking being the next highest number, then elder abuse and sexual assault. And again, we don't always see those victims. Sometimes the police, you know, they make contact with law enforcement, the hospital might see them, but we don't see that same number. And so I believe it could be higher than the clients that we're working with. And so basically we do what we can through radio spots. I don't know if you've all heard our radio spots on both radio stations. We have ads running all the time. I do Facebook announcements. So we really try to let people know that we're there and what our hours are and who we serve. So I hope all of you can come and check out the movie. It's a movie about emotional abuse.
It's a good movie.
Yeah, it is. It's a classic, and it deals with something that I see clients for. They tell me about it, and this movie is right on as far as what they're experiencing. When an abuser manipulates them to the point where they don't know what's real or not, and whether they're sane or not. And it does an excellent job of showing that.
You can never watch Charles Boyer in another movie again playing a good guy.
Oh, I know, dancing and laughing after
It's
this
tough,
one.
you know, you watch the original Affair to Remember and it's really tough. You
Right.
can't take them seriously.
No, it's a great movie, and it'll keep you on the edge of your seat, I think, if you haven't seen it.
Oh, yeah.
We have just a couple minutes left. Did I hear one more?
I'd like to announce that the Lake County Historical Society is having an open house for the two museums that we have in Lakeview. A lot of people don't even know about them. And it'll be next Thursday night from 6 to 8:30, I believe. And there's going to be an open house, but, donation only if you want to go through it. And they'll have a few things there for the kids, little costumes that they could try on and get pictures taken, like costumes from the old days. And they just can go through the museums and see what we have. They're great museums if
Yeah.
people would only go see them. Thank you.
I'm going to do a quick shameless plug for the Patient and Family Advisory Council. So we hold that monthly for our community. It's held here at the hospital. It is over a lunch hour, kind of a lunch and learn sort of meeting that we have, where we request lots of feedback from our community, from our patients and families. We have kind of a small group right now, so we're really looking for ways to kind of recruit for that. So if you would like to attend, you know anybody who would like to attend, please have them contact us here at the hospital. They can always, I just attend the meeting, but they can certainly contact me and I can get them on Corey's call list. So certainly we are looking to increase that group as well. So pass that along to any people that might be interested.
Sorry, and I have one more quick thing. The Ford Family Foundation and Rural Development Initiative would like to host a grant writing series in Lake County, probably in Lakeview this spring. So putting the bug out now, it's 4 sessions. I think the sessions are all day, like 8 to 4, 9 to 4 or something. But they're spaced, it's not 4 straight days. It's gonna be every 2 weeks or once a month or so. So put that, if you know people who might be interested in that, they're putting out feelers now.
Kind of like a learning collaborative that makes you eligible to apply for dollars later.
Yeah. Well, and
Some of those new ideas.
I've heard from a lot of different folks in the community about the need to learn about grant writing. And frankly, the more people who know how to do that, the better off we're
Yeah.
going to be. And thinking too, like Kathy Miles is trying to get a new youth mentor director in, so that person can go through. We just hired someone, maybe that person needs to go through, but yeah.
Yeah,
The more of us
I've
that
talked
fire
to Ginger
department.
about it already, and so we're planning on that.
Good.
There reaches a point when we can't have Christy writing every grant.
That's what I was
in the
gonna say,
county.
she just doesn't want to keep writing for everybody.
We've already exceeded that, and the.
Well, writing them and managing them.
Yes.
There's a big difference there. I mean, there's grant writers who write it and push them off.
Done a lot too.
And it's up to you
Managing it, yeah.
to send in the reports and all that
So-
stuff, but
Just
We're
as-
doing what Andrea and I do. Not only do we write and manage grants, but we also work with clients and
Yeah.
do everything else, yard work, housework, everything. Yeah. It's a little tough.
Just as a statistic, it, at least for the, I recently was involved in a quote for a federal firefighting grant, and that cost would have been about $3,800 for them to write the grant. No guarantee of you getting the grant after that. That's just, if you provide them with the bones of everything, they're still gonna charge you that. So it is a great need in our community. Thank you all for your time. We're gonna go ahead and adjourn here right on time, and we will see you next month.